So now let me introduce our first speaker. Cassandra Greisen is the Program Director of the Center on Alcohol Marketing and Youth at Johns Hopkins Bloomberg School of Health. She is actively engaged in projects relating to alcohol monitoring in traditional and new media, alcohol taxes, and something we all care about, outlet density. Prior to her position at the Center on Alcohol Marketing and Youth, Cassie served at Project Extra Mile, a Nebraska-based nonprofit working to prevent underage drinking and youth access to alcohol. During her tenure with Project Extra Mile, she worked closely on the campaigns to reclassify Alcopops in Nebraska and to change local city zoning code to address alcohol outlet density in Omaha, Nebraska. Cassie holds a Bachelor in Science and a Master in Public Administration with a concentration in public policy from the University of Nebraska at Omaha. Please join me in welcoming Cassandra Greisen.
Thank you, everybody. If you can't hear me, just raise your hand because I don't think we have a microphone yet. So hopefully, am I being loud enough? Can you hear me? Great. So I am just honored to be here with all of you. What a great crowd. It's just, I know Kurt was hoping he'd fill the room, and he certainly did. So as Mike shared, I do come here from Nebraska. I had the opportunity, I worked for a nonprofit in Nebraska and worked on underage drinking prevention, and we worked to pass a lot of policies regarding alcohol to reduce consumption and access to alcohol. So I bring that experience here in Johns Hopkins. And what I'd like to just start off by saying is I'm not a researcher. I'm more about research translation and using that with communities to pass policies. So just keep that in mind as I go through this presentation, and I'll take questions at the end. So with that, we'll get started. So we're going to go over a public health approach to alcohol, environmental factors, and best practices. What really works in communities to make a change on that issue. And I apologize for the screen distortion. I think I'll still be able to make it through the PowerPoint presentation. But to give you a snapshot of public health impact of excessive drinking, 88,000 deaths and 2.5 million years of potential life loss. And we just have to go over these stats because it is a bit staggering. And it's the third leading preventable cause of death in the United States. And certainly we know there are a number of public safety impact of excessive drinking. And it's not just crashes. And these were all taken from Mardi Gras, and this is the celebration from Mardi Gras. So you see the kind of public health and safety impacts that come from excessive alcohol consumption. And these are, no matter where you're at in this great country, you can see these kind of images. Alcohol is linked to criminal behavior. I don't think that's new information for anybody here, but it's always good to go over the data because it certainly substantiates it. A majority of criminal offenders were under the influence of alcohol alone when they committed their crimes, according to the Department of Justice. 40% of convicted murderers being held in either jail or state prison, alcohol use was a factor in the homicide. And approximately 3 million violent crimes occur each year in which victims perceive the offender to have been drinking. Crimes including rape, sexual assault, robbery, and so forth. And excessive alcohol use, to define it according to CDC, it does include binge drinking, which is 4 drinks in 2 hours for women, 5 drinks in 2 hours for men. So that's the formal definition for binge drinking, or heavy drinking. Thank you. Any alcohol use by underage persons, so underage drinking is categorized in excessive alcohol use, and then any alcohol use by pregnant women. So just to give you an understanding of how people are defining excessive drinking as we move through the presentation here. And excessive drinking, there are a number of risk factors, a wide range, in fact, of health outcomes that really result from excessive drinking. And it's, again, not just motor vehicle crashes, but that's what we think about most readily. It's unintentional injuries. For underage persons, 9 young people die every year from alcohol-related causes, and 3 are from motor vehicle crashes, 6 of which are from unintentional injuries. Those are drownings, falls, pedestrian goes out into the street. There are a number of factors that play into that. Interpersonal violence, suicide, of course there's unintended pregnancy, STD rates, and AIDS, and alcohol dependence, and finally liver and cardiovascular disease. And breast cancer. There's more and more research coming out between the connection of excessive alcohol consumption and breast cancer. So when you look at excessive alcohol consumption, about 75% of the alcohol consumed by adults and 90% of alcohol consumed by young people is done so in a binge drinking fashion, which results in, the kind of experiences some of you might have had in your neighborhoods, or the kind of things that we read about on the news. So for Baltimore City youth, the number one drug choice among Baltimore City youth, although marijuana is certainly rising, and I think that's coming from just the policy shift we're seeing across the country. 56.7% have tried alcohol, 22% started drinking before the age of 13, and the majority of young people leave high school having consumed alcohol. So our colleges, it's timely, we're right here at Morgan State, they're already having young people come to college with established drinking problems. So getting them young and addressing it just like you would tobacco is really important. 26% of Baltimore City high school students had at least one drink of alcohol in the last 30 days. 12% binge drink, again, that's the 5+ in 2 hours, in the last 30 days. And those are only data for those who are in school. And across Maryland, on average, 86 deaths per year among young persons are attributable to alcohol causes. It's a lot of data, but it's true, and if in Baltimore City, certainly with the majority of the population African American, it's important to look at that specifically, and African Americans are less likely to drink and binge drink than the general population. However, those who do binge drink do so often and with high intensity, and there are greater risks, and that's the bottom line here. There are African Americans drink less, but if they drink, they suffer greater consequences. And of course, we can't leave out college students. We have a lot of college students in the state of Maryland, and through the Maryland Alcohol College Survey, we have about 50%, just shy of 50% of our students binging. And that's the high risk and very high risk categories. They have drank, at high risk levels, 1 to 4 times or upwards of 5 times in a month. That's substantial. So it's certainly an issue in Maryland, although I will say it's on par with the national average, but that doesn't mean we want to be average. We want to see that number go down. And when you look more concretely at these alcohol-related consequences they're facing, certainly you see the top 3 consequences: hangover, blackouts, and academic performance problems. Those are serious consequences for our universities to be thinking about when we think of our next generation of the workforce. And finally, other risk factors: physical injury, driving impaired, and certainly sexual assault, which we hear about in the news all the time. So when we think about why people drink, can you just shout out why you think people drink? Anybody? Tell me why you think people drink.
Depression.
Depression, certainly. To be social. Any other reasons? Acceptance. Peer pressure. It exists for adults as much as it does for young people.
Think that they don't have a future.
Don't have a future, yep. And I would say it's because they can. It's because they can. And there are environmental factors in our community that influence that. And the alcohol industry is very good at their marketing practices, and they use the 4 P's of marketing: product, promotion, price, and place. And we're going to talk about these 4 P's and how it relates to alcohol. And when we're talking from a public health perspective, it's our duty to think about this in that context and to try to address these 4 P's with policy actions. So looking more deeply at product. These are the top 10 brands consumed by alcohol or consumed by young people. And this is a national study that was done of 1,000 young people, 13 to 20, and these are the products broken down by race, what they drink. Further, this is a Johns Hopkins ER pilot study, so just one hospital, one ER room, so keep that in mind. But what you see here are the brands that came up most common when those who came with an injury to the ER during the time of the study. These were the products that they had been consuming during that period of time. The red indicates malt beverage. There are some malt beverages in there, but what it does indicate is that they have the larger market share of those who were in the ER than they do in the marketplace. So when you look at promotion, malt liquors in particular, because it just folds right out of that ER study, storefront malt liquor adds more common in African American communities, and malt liquor consumption is associated with greater adverse consequences of alcohol use, which certainly correlates back to that ER study of those who were finding themselves in the ER with injuries. And these are some of the first brand studies that have been done in the country. That was really how tobacco made its turning its corner in terms of addressing tobacco use among young people, was looking at the brands and how the marketing practices were done for those particular brands. So we're doing some of that that research here now on alcohol, and I would say we're about 20 years behind the tobacco movement when you look at it from that perspective. But it's being done now, and it's exciting work. So then you see supersized Alcopops. Alcopops are these fruity-based beverages that appeal to young people. Even the alcohol industry, when they first came out with the product, said these are starter drinks. These are to hook, in the person who's not yet consuming. Boys certainly more prevalent to drink beer, and young girls more so distilled spirits. And in part, that's done because of these types of products called Alcopops. With that being said, there's a new study, and who's familiar with Four Loko? Anybody? Juice, Four Loko. They're about 23.5 ounces, 4 to 5 beers equivalent in one of the cans. It's not uncommon that you would see this a drink of choice for young college-age students. Talk about binge drinking. It's called Binge in a can. That's what it's been dubbed, because that's essentially what it is. You get 4 to 5 drinks in one can. It really expedites the process. But this new study came out in 2015 and said young drinkers who consume supersized Alcopops more likely to report heavy episodic drinking, which is binge drinking, and have injuries from drinking. And to just show you the impact of policy on this front, these used to have caffeine in them, and it created a wide awake drunk. It masked the feel of intoxication, so you didn't think you were intoxicated. You drink more as a result. And in this country, I'm proud to say, there were a number of states' attorneys who got together to ban caffeine being mixed with alcohol. And those producers did voluntarily come to that place, but as you might imagine, there was quite a bit of peer pressure on that front. And then price. So we've gone over product and promotion, and now we're looking at price. Increase alcohol taxes, one of the best bangs for your buck, if you will. Increase alcohol price through alcohol taxes, and result, you're going to get lower excessive alcohol consumption and lower costs and consequences as a result for communities. It's not rocket science, but we still need this kind of data to prove. In fact, this does do this. So the economic costs of excessive drinking, according to the CZC, are substantial. It's about almost $2 per drink in economic costs, but really the government pays for about 42% of those costs. So about 80 cents per drink consumed in the United States. That's not covering the cost that the kind of consequences that it has on society. And those costs are calculated from losses in workplace productivity, healthcare costs, criminal justice, motor vehicle crashes. These are the things that you would think about, certainly. And the health and safety benefits that come from alcohol tax increase, you get and this is all borne out in the literature, you're going to get a decrease in binge drinking, motor vehicle crashes, violence and other crimes, health problems, unplanned pregnancies, hospitalizations, child abuse, unintentional injuries. The list goes on. And the thing about alcohol taxes on a national level, they haven't been raised they aren't rising with inflation. So a drink has never been cheaper. And price does matter, especially for young people. And if we were to, if we would look to doubling the federal alcohol tax, which would be what is appropriate at this point, it would lead to an average 35% decrease in alcohol-related mortality and 11% drop in traffic crash deaths. It'd be a substantial benefit. So now we look at place, which is really where I want to focus most of our energy tonight. When you look at place, the number of alcohol outlets makes a difference. Increased alcohol availability, increased alcohol consumption, increased public health safety problems. Outlet overconcentration is a key public health and safety concern, and those of our friends here from Federal Hill, for example, who they're in the back, hello, welcome, they are experiencing that with a high concentration of alcohol outlets in their area. And alcohol outlet density can be defined in two ways. You have, or challenges with the density. You can have too many outlets in one concentrated area, and the type of businesses that are there. If they're higher impact in terms of bars or liquor stores, they tend to have more negative externalities than those that are, like in Nebraska, you can sell alcohol in grocery stores. You can't here, but those would be considered lower risk establishments. At any rate, and it also could come in the form of having a problem alcohol outlet, like York Road Partnership just came up against on York Road with Favorites Pub. You know, you have one outlet that's just wreaking havoc on a community, and you go for recourse time and time again, and you're not getting it before the liquor board or the regulatory body, and it can really have some negative impacts. So there's lots of data out there that shows more outlets, more risk, and there's a lot of data. I'm not going to read it to you. I don't want to bore you to tears, but just know the research bears it out that some of you who are feeling this in your community, more outlets, more problems. And alcohol outlet density and underage drinking, that's certainly borne out too. And if we just focus in on Baltimore specifically, alcohol outlets and communities are strongly related to poor outcomes for youth, whether it be school performance, violence exposure, or drug use. I mean, we know that in Baltimore City we have about, I believe the statistic is about 56% of Baltimore City school children have an alcohol outlet within a quarter mile of their home, while only 13% of them have a grocery store a quarter mile from their home. That's a startling statistic, and I don't know if that's the kind of environment we want to create for our young people. So when the number of alcohol outlets increase, and then we've kind of talked about this already, so do the problems, and here's the long list. And I think it's interesting, a lot of people don't think about the connection between alcohol outlets and sexually transmitted diseases, but they are definitely correlated, and it's an interesting find, honestly. And so let's just look at Baltimore City and what we know about our alcohol outlets, and that's a tongue twister, I will say. But Baltimore City has doubled the number of liquor outlets. You know, the population was once a lot greater, and the people left and the liquor store stayed. And so the state standard is 1 for every 1,000 people, and Baltimore City has 1 for every 470 people. And so to your, I think it's your right, yes, the right, you will see a counter message about alcohol. Talk early, talk often. What does it say? Anybody can read it? I can't even read it, it's so small. Anyways, encourage you to get involved. Thank you. Get involved, the important piece. But what happens with these messages, while they're really important, we don't have a lot of money to put them up, but the other piece to it is they get overshadowed by all these other messages. And it's just nearly impossible to fight that. And these are the kind of the 4 P's of marketing. This is what we're talking about. And this is what we see just on our own streets. This is Park Heights. Anybody from Park Heights with us tonight? No? They have a lot of outlets as well. And so we experience the violent crime here in Baltimore. I don't think that's a secret to anybody, but it's getting better. But here's a little depiction of how it connects to alcohol outlets locally. The bigger the blue dot, the more outlets, and the deeper the red, the more crime. And there definitely, you can see a correlation there. And then the vacant buildings and liquor stores and HIV. When you look in Baltimore, the communities that have the highest number of vacant buildings and liquor stores also have the highest homicide rates, which is the blue circle, and the highest HIV/AIDS death rates. That's the purple circle. These health outcomes are connected to the kind of environment we're creating around alcohol in our communities. So what can we do about it? What does the evidence say we can do about it? What really works in communities? And I think there's some just general principles we should think about as we look at adopting these types of policies as we move forward here in the discussion. Population level approaches, which is really those in changing the environment in which we live around alcohol, they are more effective and cost effective than individual level approaches. And individual level approaches are kind of exactly what you would think, one person at a time, getting them help. But we will never treat our way out of this problem, or we would have done it already. And treatment is, in our opinion, the moral responsibility of a humane society that makes addictive products widely available, which we do. So the most effective strategies are generally the most difficult to implement. And education is not controversial. And that's the other thing. They're most difficult to implement, but they're also the most controversial typically. And education isn't controversial. Most people are very comfortable there. However, it's not very effective, especially in isolation. It can be a complement to a lot of policies, but not in isolation. It won't make the kind of changes we're hoping to make around those 4 Ps we talked about. And the policy changes, which is all about restricting any of the 4 Ps, is extremely controversial and requires a lot of political will. And if any of you have tried to address an alcohol outlet in your neighborhood or anything around alcohol, I'm sure you've received and felt that pushback. So what do we know works? And it's primarily coming from the CDC and their community guide that comes from an independent task force that scours all the literature base that's out there. All right, so CDC tells us what works based on the literature. So communities have tested things and they've evaluated it, and here's what they found. Here are our best buys: increasing alcohol taxes, regulating alcohol density, dram shop liability. Maryland is one of only a handful of states that doesn't have dram shop liability. Dram shop allows, if there's a sale to an intoxicated individual or a young person, to go and seek recourse if there's an innocent third party that's been injured. And the same goes for the social, which is the social availability of that as well. Privatization of alcohol sales. There are 17 states in the country that are control states, which means that the state controls the sale of alcohol, and we have one county here, Montgomery County, that is a control county. Otherwise, the majority of the states are privatized, meaning you can get a liquor license and you can sell alcohol. Looking at those different states, which is interesting, you get to compare, the control states tend to have lower consumption rates, less and fewer problems as a result. And then, of course, maintaining limits and hours of sale. There's been a lot in terms of Irish strolls happening with the holiday that we just passed. And I had a community person, Diana, in the back, asked me, is there any literature out there about bar crawls? And I said, well, I don't know of any specific research on bar crawls, but what I do know is the literature says if you open up sales from hours to days, you are going to increase the kind of experiences that they had, unfortunately, around Federal Hill as a result of those increased sales. And then finally, enforcement. All of these policy changes are really only effective if you have concerted effort on behalf of law enforcement, their buy-in to really enforce these laws, and particularly prohibiting alcohol sales to minor. And I'll just reference back to the effort that happened with Favorites Pub, Craig's, at the Liquor Board, that had a suspension of 104 days, and one of the incidents that happened there was 125 of the patrons, and I know many of you are familiar with this case in the room, I see some head nodding, but 125 of those patrons, 105 of them were underage. I think I got those numbers right, John. 105 were underage. And you have to say, whoa, what's the business plan here? And it appears clear, doesn't it? And so the Liquor Board responded. But there were 10 years of heavy effort to try to address that establishment with little recourse. And so we had a window of opportunity, and you know, I think it'll be interesting to see what happens at the renewal period with that liquor license. But so it just speaks to the power of enforcement when you start doing those kind of inspections, and what you see. There are a lot of great operators out there, so don't get me wrong. There are good outlets, good neighbors that you want to have in your community, and I think we're all supportive of that. It's the problematic establishments that we're pointing to. And so the Maryland Collaborative is an initiative for college students that we are working on through Hopkins as well as College Park to try to address excessive alcohol consumption among college students. And there are 10 college university presidents that came together in 2012 to establish this collaborative. And through the collaborative, and it's funded through DHMH at this point, and it's staffed with public health experts from Hopkins, and I have my colleague here in the front, Molly Mitchell, raise your hand. Thanks, Molly, for being here. And we're doing some pretty good work, and it's growing. We have up to 15 schools that are involved now, a number of them within Baltimore City, and it's all about understanding the problem and taking action and helping these universities implement what's evidence-based, which is really difficult to do, as we're going to talk about. And this guide to best practices that you see here, it's really leaned heavily on the CDC's recommendations and their best buy list, but it's very much catered to what college campuses can do both on their campus but in the community around them, which means they need all of your support. You know, they are not isolated on their campuses. They know that very well, and they want to be good neighbors, and we're helping them figure out how to partner with their communities if they're not already doing so, and many are, to implement some of these evidence-based practices. So looking at these policy responses, going back to product, anybody hear about powdered alcohol recently? Yeah, it exists. There's always an entrepreneur out there. But as of March 2015, there are 5 states that have banned it officially, and 23 state legislatures, including our own, and I put up some information in terms of when that hearing's coming up and what the bill numbers are, but there's legislation here in Maryland to move forward with banning them. It's just, you know, a kind of product that I think some certainly have concern for young people. It's easy to conceal, it's high octane. And then, of course, the Maryland Collaborative had a great success to ban 190 proof grain alcohol in the state, which was again, had no taste, no scent, and mixed frequently, called jungle juice. Perhaps you've heard it referred to that before. Anyway, these are your Everclear type products, and it just high octane, you know, perfect for binge drinking in college students. And so it was important to get it off the market, and we were able to do that successfully in Maryland through that collaborative. And I think that speaks. There was a Frostburg State University president tried for years to get that done unsuccessfully, but with the power of 10 college presidents coming forward to, you know, collectively do that, they were able to move forward. And then alcohol impact zones. Has anybody ever heard of alcohol impact zones? It's kind of a unique approach using zoning and land use, and Washington State has been kind of paving the way on this, but it allows you to ban certain high octane beverages that you don't want to see in your area. You'd obviously have to prove your case for why it would be needed, because you know, certain crime, violent, whatnot, but it's a way to begin to restrict even those little shooters that you see, at least in Nebraska. You can see them at gas stations at point of purchase, and it's but in Nebraska you can also buy cold ones right there at the gas station too. So I think Maryland's ahead of the curve in that regard. But anyway, so there's some unique options here for communities, especially at a local level, to start making an impact around product and what you see in your communities. And then looking at promotion, this is a billboard that's next to a school in Philadelphia. And you would not see this in Baltimore City, because in the early 90s there was a movement of a number of African American grandmothers who got together and said, no more, we do not want these kind of billboards in our residential neighborhoods. And so they passed it legislatively. And not only did they pass it legislatively, they worked tirelessly to take it all the way and protect it at the U.S. Supreme Court. And when it is enforced, which again goes back to that pillar that I keep talking about, when it's enforced, the number of alcohol and tobacco billboards you saw fell from 1,300 to 70. Yes, a success for Baltimore City. And then these are some counter ads that students at MICA have done through an initiative with Greenmount East and East Oliver, through their coalition, Underage Drinking Prevention Coalition. They have been working with them to create these counter ads to disseminate a different message about alcohol. And price. We talked about alcohol tax increases, and it's well established in the evidence in terms of its effectiveness. But Maryland did add a 3% sales tax increase on alcohol in 2011. Everybody familiar with that one? Well, to talk about the political will that was needed for that, substantial. Statewide coalition of 1,200 groups. And of course, this was well before my time living here, but I said 1,200 groups or individuals? No, 1,200 groups. That's substantial political will. But it is a heavy lift for any state to take on, for sure. And then early evaluations are showing reductions in consumption and STD rates. So I know we're all looking forward to that paper getting published. The place. This is, again, where I think we have the most opportunity at a local level to do something. And right now, I know many of you are familiar with the Transform Baltimore initiative, the Rewrite. And it's an opportunity to right-size our outlets in Baltimore City. But it's controversial. Has anybody heard about this initiative? It's quite controversial. Yes, our councilman, of course. He could talk about the political pressure, I'm sure. But it's there are good outlets that are possibly going to be lumped into that equation in terms of getting rid of the liquor stores that are in residential outlets, and that's causing the controversy. It's taking away someone's business. It's difficult to do those things, and those establishments have been grandfathered in, and they're here, and I think many thought that it would go away over a 4-year period, and it just hasn't. And then, of course, there's a lot of pieces to that. I mean, 3 components to that rewrite. One is to get rid of the liquor stores that are in residentially zoned areas. The second is to that there would be at least 300 feet between existing outlets. And the final is to enforce through planning that taverns, there are some that are sham taverns, if you will. They are really operating like liquor stores. They are not taverns, but taverns get the most privilege in the city in terms of days and hours of sale. So it's important that we, enforce that because there is a moratorium on liquor stores in the city, and so some have circumvented that, got BD7s, and operate as liquor stores. So there is a piece of the legislation that would address that. At this point, I believe it's in committee, is that right? And it's part of a much larger piece of legislation that's over 300 pages long, and it's going to be a long, long process, as it has been. I think it started in 2008. It's been no, not quite.
Well, the planning department started their
Yes.
part of it.
That's right.
And the council, I think we're coming up on 2 years.
Yeah. So this kind of stuff can take a long time. That's a short story. But there are other opportunities to right-size the alcohol outlets, and one is called a DAO, or a nuisance ordinance. And there are some of us here very interested in what that could do for Baltimore City. And then social host ordinances, which are some of our college campuses are working on, and Molly has some materials for that. So just going into the nuisance ordinance piece of it, it's tied to the certificate of occupancy, so it provides another avenue through the city structure to address problematic alcohol outlets versus going to the liquor board. So you would have the option to go to liquor board, but you could also go to the city council through this mechanism. And you would create sets of operational standards specifically for outlets, reflecting community norms and standards. And if those operational standards are violated, then it would trigger the process to go before city council. And ultimately, if there was a business that refused to mitigate the issues that were surfacing, it could have its certificate of occupancy pulled in this piece of legislation. And as was mentioned in my bio, this is something I worked on in Omaha, Nebraska, to pass, and they just used it 2 years later, and it was actually an alcohol outlet on another outlet that was causing lots of problems in their area. He was seeing a drop in his business and went and took it before the city council, but it took a very long time to pull the certificate of occupancy. As you might imagine, you had to build a very strong case because that's a strong action. Usually the point is to get it mitigated and get them into compliance, and they can be, a good operator in the community. So it's also an additional tool besides the liquor board, like I mentioned, for citizens to address outlets that are problematic in their neighborhood. So it's just another avenue. It's not circumventing anything, it's just another avenue. And it can create a funding mechanism for regular and routine enforcement, which I think would be very helpful around outlets. And typically, there just aren't enough funds out there to do the kind of enforcement proactively that we need to do around outlets. So this could create a funding mechanism for that. And how it works is that alcohol outlets pay a fee into the city coffers, and it goes to dedicated enforcement in the ideal scenario. And finally, you could do cost recovery. So if you routinely have to go back to that establishment, and this theory, of course, is similar to what many have to do for too many times the fire alarm is pulled, you all of a sudden have to start paying for those city resources if you're not fixing the fire alarm. Same kind of concept. If you're not fixing the issue that's causing city resources and taxpayer dollars to come out and keep addressing the same issue over and over again, there's an opportunity for recourse for taxpayers, quite frankly, to get cost recovery in that way. There's hundreds of communities in California that have adopted ordinances like this, and also in Omaha, Nebraska, and other places. I have community guides at the front here that help walk communities through step by step how to do something like that if there's ever any interest. But I think it's another opportunity for Baltimore City to right-size the outlets, and it's not lumping in every outlet. It is literally just saying, here's our new standards, and anybody that's problematic, there's another opportunity to address the situation. And then social host ordinances. Social host ordinances are a unique tool that also have generated, honestly, from California as well. They've really spearheaded much of this public health work around alcohol. But it's done through zoning as well. And what it does is holds the host or property owner accountable. So if there are underage drinking parties that are recurring at a home, you can hold the host, which might be the college student, but also the property owner, which might be the parent, or it might be the landlord. Exactly. And so it helps hold the host and the property owner accountable. It's civil, not criminal. Right now, we do have a social host law in the state, but it's criminal and it's a high burden of proof. It's very difficult to use, and so it's just not being utilized. That's the result of that, unfortunately. This brings it down to a civil penalty, so it's lower burden of proof, and it's a fine, just big old speeding ticket. Really, in the end, that's what it is. And then it's additional tool for law enforcement. You're going to keep seeing a theme here, additional tool for law enforcement, because enforcement is really important and a critical pillar to getting any of these policies moving forward and implemented. And again, you have another option for cost recovery. I don't know about you, but as a taxpayer, it's a little frustrating to be subsidizing some of these ongoing issues. So there's an option here for cost recovery as well. If the beauty of this is, of course, these local ordinances is that you can craft them based on what the community wants and needs. So, for example, some communities that we're working with through because these are all universities that are working on these issues with their community partners, some are going to look at the landlord piece and try to hold them accountable. Others aren't looking at that because it's just not a great need for them. So it can be crafted in such a way that reflects the needs and the desire of the community. It's not a one-size-fits-all, that's for sure. And I know Molly is working with Johns Hopkins University and their community partners to work on a Baltimore City social host ordinance, and there's an issue brief that you can read, a resolution of support that you can sign if you are supportive in concept, so you can grab her after if you have any questions more specifically about what Baltimore City is doing on that front. So in summary, product. You have these alcohol impact areas that you can implement, and of course we already know what's happening with powdered alcohol even here in Maryland. Promotion, you can have local ad restrictions and counter advertising, as we saw in Baltimore with the billboard restrictions. Price, alcohol tax increase. 2011, Maryland just passed one and is already seeing benefits, public health and safety benefits in place. You have zoning reform options and social host ordinances to start changing the environment where alcohol is sold to reduce and mitigate those public health and safety concerns. So with that, this just speaks to the need, the kind of movement that you need to pass some of these policy changes, organize, build coalitions, advocate. And with that, I will open it up to questions, if there are any.